Hi, I'm Sherry Priebe, and I have two students with me, Iris and Alyssa, and they are dental hygiene students from the University of British Columbia Dental Hygiene degree program. And here we are doing a international Vietnam learning initiative. And I'd like to just ask them, when they first applied for this program, that they had ideas of what they would see and what they would experience. Now I want to ask them if their first impressions when they first started seeing some of the places that we were here, and then also how you think it might impact your life, your dental hygiene career, and just how you see the global oral health in the future.
Okay, thank you, Sherry. Big questions. I think for me going in, I expected, we're going to be working hard. We're going to go see a bunch of orphanages and work with children there. And we're also going to see and experience and learn more about oral cancer. And so that's what I went in thinking about. And having been living it and doing it, I realized everything is just more intense. We're working harder than I ever thought we would. We're seeing more diverse orphanages with totally different challenges and unique features to each. And the more intense oral cancer, just crazy, intense, severe cases that I never thought we would experience. And we got to see them and feel them and talk with the patients, which was really, really cool for our own learning, to see just everything is more intense than what we could have imagined before.
Yeah, exactly. So like going into the trip, you kind of had an understanding that it's like bi-directional and dynamic. We're not only applying our skills and our knowledge, but also learning and exploring and experiencing all these different things. But I don't think we anticipated just how much learning occurred, and also just how Alyssa was saying, how everything was just so much more. So I just think this whole trip kind of like exemplifies pushing past borders, because not only are we in a different country, but we're outside of the typical traditional clinic setting, and we're also being pushed past what we thought we could do and handle, but then working together as a team, like we could do it. So that was really amazing. And
Yeah, definitely feel that too. I think maybe in the future how it's impacted us, I think it's really increased our understanding and realization of our roles and duties as healthcare providers, that we do need to provide services and care for all types of people in all these different situations at the orphanages and at the oral cancer center. We need to see our privilege, how lucky we are, and we need to help others who are maybe less fortunate. And it really, exemplifies the true need for these oral cancer screenings and opportunistic screenings to catch these oral cancers early, because we've seen the incredible devastation that happens when they are diagnosed late, and it's just palliative, poor prognosis treatments that end up resulting. So I think that's something to take back with us, the real importance of that.
yeah, and not only the importance of it, but that we can take part in this, and like outside of clinic, we can also work in hospitals and orphanages, and education as well. And that it puts things into perspective as well, that there is this need, and ultimately there's a choice. Like, do we live in our privilege, or do we reach out and take action? And I think this whole trip just really solidified the decision, yes, we want to be a part of something bigger than ourselves.
Thank you, ladies, so much for your input, and I appreciate working with you so much.
Thank you,
You're
Sherry.
superstars.